In the previous part, we have talked about the contraindications of the removal of impacted, especially third molars. And now we want to talk about the surgical and perioperative care for non-third molars which are impacted. Okay, the first one is the exposure-only approach, which means that the surgeon applies an incision in order to free up the crown of the tooth, which is impacted, and let it to erupt naturally. And the other one is the incision or exposure and bonding. Okay, and these two are applied simultaneously. Okay, so the surgeon applies that incision in order to free up the crown and uses the brackets in order to orthodontically guide the tooth to erupt in its natural order and to be in shape orthodontically. And the other approach is the surgical approach. In this surgical approach, first of all, the surgeon tries to have the mucoperiosteal flap, applies the mucoperiosteal flap in order to reach to the crown of the tooth, and then tries to remove the bone and conservatively remove the bone, and then either the surgeon can use the brackets or not, according to the order of the teeth and the to make the orthodontic order. But these approaches vary very differently according to the condition and conditions and the situations and the exposure pattern of the impacted teeth. Either it is labiously partially erupted, or completely it is impacted, or either it is palatally partially erupted.